We are now 2 years into the pandemic, and COVID deaths here in the U.S. surpassing 900,000 on Friday and projected to hit the 1 million mark by April. This as the CDC now says 64% of Americans are fully vaccinated. Tonight, a look at those numbers here in Alabama.
We do feel like we are probably plateauing in our state right now, thankfully.
Encouraging news from Alabama State Health Officer Dr. Scott Harris. While the Omicron surge appears to be on the decline, the COVID numbers continue to add up.
We have, unfortunately, passed more than 17,000 deaths in our state. I will tell you that all of last year in 2021, we had just over 500,000 cases in our state. So far, just in the month of January and a couple of days of February, we've had over 300,000 cases this year. So more than half of the cases in the last month than we saw in the entire year last year.
As you all know, I am a pediatrician, and my biggest concern at this point is keeping kids in school, keeping kids learning. And
kids account for about 19% of overall cases in Alabama, with vaccine rates hovering around 12.5% for 5 to 11-year-olds and 36% for 12 to 17-year-olds.
Our cases have gone down from about 24,000 in schools last week to about 9,800, which, that's still pretty high, and I'm not really satisfied with that at all, but it is good to know that it's going down.
Medical experts say one way to keep those numbers going in that direction is to get vaccinated. In Alabama, more than 3 million people, or 61% of the state, has received at least one dose of the vaccine. Overall, more than 2.4 million people, or 49.5%, are now fully vaccinated.
I'm never going to recommend anything for your family that I would not do for my own. And in a time where we don't know as much as we would like about this vaccine because of time, we also don't know much about COVID. And the unknowns about COVID are worse than the unknowns about vaccines. For me, this vaccine has been studied and monitored as closely as you would ever see in a vaccine.
As of right now, Alabama is still only receiving about 1,200 weekly doses of monoclonal antibody treatments, which they try to evenly allocate across the state. They don't expect supply to increase for at least another month.